Good morning. Good morning. Can everybody hear me okay? Great.
Yep.
All right. We'll just give people a few minutes to arrive. Great.
Maybe they can't find a place to park.
Exactly. I know. I know many of us have had these back-to-back meetings. It's going to feel strange when you have to like make time to drive again in between. All right. Here we go. We have about 30 to 40 people that registered, so we'll see how many people we have. Good morning, everybody. Welcome. We're just taking a minute to let a few people in, and then we'll go ahead and get started. All right. Perfect. Okay. Why don't we go ahead and get started? It's 9:31 on my clock. Welcome. I'll continue to let people in as they arrive. And they are arriving, so I just need to let a few people in. And then we'll go ahead and get started. I actually will just kick us off with a welcome and then turn it over to our colleagues at the Department of Human Services. And want to thank everybody for joining us this morning to talk about a potential or an upcoming RFP to support family, friend, and neighbor care. I do want to let everybody know I'm recording this session. So if anyone is uncomfortable with that, please turn your camera off. And you can utilize the chat because if we make the recording available, we do not make the chat available. So. Okay. All right. Well, I want to welcome everybody on behalf of the Prenatal to 3 Coalition and all of the great partners that are here at the table. I'm excited today to have this conversation with the Department of Human Services. We have a great team working on the family, friend, and neighbor care. And I believe, Cindy, I see you online. Would you like to do a quick round of introductions with everybody before we get started? Or would you like people to put their name in the chat?
Yeah, thanks, Laura, for asking. It would be great if folks can put their name and their affiliation in the chat.
Yep, great. Okay. And I will get you the registration list so you know who has all registered for the meeting. But it looks like we have just about everybody who is registered. So clearly people care about this topic. So I'm going to go ahead and turn it over to you, Cindy.
Great. Thanks, Laura. And Laura knows this, full disclosure, I work off of 3 screens. And so if I'm not totally facing you all, I'm paying attention to the conversation and also looking at my notes here. But good morning, everyone. I'm Cindy Yang, Director of Child Care Services Division at the Department of Human Services. Child Care Services includes Child Development Services and the CCAP program, and then also some systems building work that we lead or help or participate in. And so I really just want to thank you for this opportunity today to talk about the recent federal stimulus package and the potential impacts for childcare in Minnesota, specifically around FFM work. And then I also just want to note that we do have a few other state folks on here, Tracy Roloff, Amy Runk, and then also Jeff Smith, who will be helping to take notes. So they will introduce themselves a little bit later on with our presentation here too. So with that, Jeff, do you want to pull up the slides? We have about 6 or 7, 8 slides that we want to show here. Great, thank you. So just to give a little bit of background, it's looking a little bit off to me. I don't know if it might just be my screen here, but can folks see the slides? Laura, can you see the slides?
Yep,
or are some?
It looks great on my end.
Okay, great. So I do want to provide just a brief update on the use of the coronavirus response and relief supplemental appropriation, also known as CRSA, which was passed in late December of 2020. It feels like a long time ago, but this particular use of funding through this federal appropriation, DHS is issuing $135 million to support child care providers and families through the services through 5 different efforts. The first one being that we're anticipating, we've committed $3 million in funding to continue and expand the efforts to provide support to family, friend, and neighbor caregivers. The second priority is infusing $35 million into the basic sliding fee program over a few different calendar years to increase the number of children served off of the agency waiting list. The third is to set aside some funding for family support initiatives over the course of the next 6 to 12 months to target support to emerging needs. And then the fourth priority is to continue the COVID Public Health Support Funds program with $87 million for January through May, which is we're wrapping up that priority soon here. And then the fifth is provide $5 million in funding to support childcare programs to build sustainability, reopen or start up through consultation, business supports, grants, and loans. But for today's conversation, we will be focusing on the first priority, as I mentioned earlier, providing $3 million in funding to continue and expand efforts to provide support to family, friend, and neighbor caregivers. Next slide. So for this slide here, I want to provide a quick overview of the more recent new federal stimulus funding, the American Rescue Plan Act, also known as ARP, which was signed into law by President Biden on March 11th of 2021. This act appropriates $1.9 trillion in federal emergency funds to address the COVID-19 crisis. And of these funds, $39 billion was appropriated for child care relief. For our state, we received about $535 million through the Child Care Development Block Grant, also known as CCDBG. How these funds will be utilized and distributed is being negotiated right now by the legislature and the administration, which may or may not present additional opportunities to support FFM providers. So I wanted to just provide that quick overview of these funding sources here. And with that, I will turn it over to Tracy.
Thanks, Cindy. Good morning, everybody. It's really good to see you all. Thanks for the opportunity to have this conversation with you all in this space about this very important issue of supporting family, friend, and neighbor providers in our state. Thanks to Cindy for that overview of the funding landscape. And so now turning into, one of the reasons we're so excited to have this conversation with you today. As Cindy discussed, we're considering potential uses of the $3 million of SRSA funds to support family, friend, and neighbor providers. And through input with stakeholders, including this group and others over the years, going back in time historically, but there's been, increased focus on family, friend, and neighbor providers conversationally. We know that there's, was a bill moving through the legislature this year, and we've been able to have some input with stakeholders like yourselves on what is needed in the state to support family, friend, and neighbor providers as an integral component of the early care and education landscape in Minnesota. And so as we look at this $3 million of SRSA funding that's been allocated for this support, thinking about how we might disperse those funds through a request for proposals at a top level, organizing all of this input into some goals and intended uses for the RFP, and want to share those with you today and get your feedback and thoughts. And so we've been able to kind of sort through and analyze the input we've been getting and identify 3 primary purposes with several activities to support these purposes. The 3 primary purposes being to establish systems, increase provider participation and access, and to develop support services. As potential activities within establishing systems is to invest in a consistent, coordinated, and sustained statewide network of support that's inclusive of family, friend, and neighbor providers, to provide support and technical assistance to targeted community-based organizations to increase their capacity, and a focus on communications and marketing to increase family, friend, and neighbor providers' awareness of existing beneficial resources. With the primary purpose of increasing provider participation and access, activities such as increasing the cultural diversity of childcare providers in our state, and increasing the number of registered L&L providers and family access in the state. Just a really quick, for those who may not be familiar with the term L&L, legally non-licensed is what L&L stands for, and that's a specific subgroup of family, friend, and neighbor providers in the state who have done the work of completing some specific trainings and registering with the state. And one of the benefits of completing that process is having the capacity to receive the Child Care Assistance Program resource for the children they care for, including some other benefits. And finally, the last primary purpose, develop support services with activities including grant funding for organizations to provide materials and resources to family, friend, and neighbor providers to meet their needs, planning and needs assessment activities, and evaluation. So that's how we've kind of summarized the input and themes into those broad purposes. And at this point, I'm going to hand the baton off again to Amy Runk, who's going to facilitate and lead us through some questions around these intended uses.
Great, thanks, Tracy. Next slide, perfect. Hello again, my name is Amy Runk. I am not sure if I've gotten to meet all of you. I am newer to the state. I started in April 2020, just after everyone was sent home and all of our worlds changed so much. So it's an honor to meet you guys today, face to face, kind of, and just kind of hold this discussion and some space to talk about how we might use these funds and get your feedback. So we do have a couple of questions to guide the discussion. Feel free to also share responses in the chat. This is kind of a large group and it is earlier in the day, so no pressure if you don't feel like speaking out in the large group. Feel free to throw any thoughts in the chat and we'll monitor those as well. So when we think about the 3 buckets that Tracy went over. We are considering funds for a variety of uses that fall out of those 3 buckets, around networks, around access, and around direct support supplies and stuff like that. So out of those buckets, was there anything that stood out that was really missing from those intended uses? Anything that wasn't there, anything that was unclear around those intended uses?
I'm curious about any training opportunities for this group. And I used Friends and Neighbors when my children were young, but I do think some guidance, some sort of expectation clarity would be helpful.
Clarity around trainings, or just in general, you feel that trainings are missing from these uses?
I don't see, and I was looking for it. Is there any training opportunities for providers?
Okay, perfect. Captured. Thank you. Yeah, that's a really good one that may be missing. Any other things that are sticking out that you know you've heard from your networks that you could use support on that isn't captured here?
Amy, this is Laura LaCroix Dillon. Can you tell me who would be eligible grantees? It's not clear based on what you have listed here. And I'm sorry if I missed it when Tracy was going over this.
No, and I'm going to pull in Tracy and Cindy to comment on this as well. Because we're so early in this stage, I don't know that we have fully identified who eligible grantees would be. Tracy or Cindy, any more input or clarity on that?
I'm pausing and waiting for Cindy.
Yeah, this is an element. This is a question that has come up before too, even in the context of who qualifies in terms of, do they have to be a nonprofit? Do they have to be a provider? So this is definitely a valid question that we're trying to figure out on our end too. Cindy, do you have any other thoughts?
Yeah, that's a really good question, Laura. I mean, I would be very curious to get your input on that, and you meaning this whole group here. You know, we know at minimum who could be eligible based on our current contracts that we have, where we pulled what we didn't mention here is when we moved into our crisis with COVID response, we allocated $1 million from the CARES, the first federal stimulus relief funds known as CARES. We pulled $1 million from there and really quickly needed to stand up some kind of support system for FFM providers. And the pathway that we ended up moving forward with to stand up that support system was looking at current existing grantees that we had. And so we tapped into four nonprofits to help pull together that support system. And then we went down what's called in our state system equity select contracts. And so that specific effort was targeting towards vendors that were a part, that were registered through the state system, through the equity select pathway, where we would contract directly with individuals who were on that vendor list. And so we know at minimum that those are, we're not going down that equity select because there's a limited amount of pool, a limited amount of dollars, and that's only up to 25,000, I believe. And so for this particular pathway, we are going down the RFP because that will help broaden out the number of potential grantees that we could tap into. And so I don't think that necessarily directly responds to your question, Laura, but I would love to hear and just get folks' thoughts about your question too.
Yeah, and if you don't mind if I jump in as well, just Cindy and others to provide a little bit of context is, and thanks to all of those who are on the call who we also had a very rich discussion with yesterday. Appreciate you being with us yesterday and then today, and really still trying to reflect on some of that feedback, but it's recognizing that the many ways in which, being really grounded in the specific challenges and hurdles that exist in, doing business with the state, and recognizing, and reflecting on the feedback that a lot of the organizations in the state that are best positioned and poised to be that source of a trusted relationship and support system for FFM providers. There's often inherent challenges in terms of what it means to jump through the hurdles of doing business with the state of Minnesota, and really examining the different tools in our toolkit that we have for us, entering into those contractual relationships with folks. Just to name a few, we have a whole process from mini and micro grants. Cindy mentioned the equity select contracts. We have the bigger contracts, through an RFP, and being really cognizant and reflective of the ways in which the way we do business makes it really challenging for some organizations who are doing that good work with FFN providers to navigate that contractual relationship. And so really taking a good hard look at our toolkits and how we might create a portfolio of options within this RFP process. So that's kind of a long-winded way of saying we're not locked in to just doing one RFP that only operates in one way. And part of the feedback that we're hoping to get from folks today is helping us craft up a package of how we can get this money out to best meet the needs of the FFN community and support the organizations who are doing the work, and that work differs and looks different based on the type of organization and the needs of the community. So just wanting to kind of throw that in.
Great, thank you. And then just as we wrap up this question around what is missing, I want to keep it open, but also just specifically focus it on the developing support services, especially if anyone has any insight around anything that's missing around specific supports for providers that they might want to clarify or call out that they would really like to see as a considered potential inclusion for this funding.
Can I go back quickly? This is Laura again. Can I just go back to the eligibility question just really quickly? In the legislation that many of us worked on, trying to keep it as flexible as possible would be really helpful. And whether it's funding a network or funding a specific provider, or working through a nonprofit, and then the potential of for-profits. I know you did that in your micro grants, but I do think having that variety is going to be really important in this population, because many times these are informal networks, and we want to make sure that we're remaining as flexible as possible, as you had mentioned. So keeping all of those options, and then the public entities too. I'm sorry, Betty, but I just want to also say, we know a lot of FFN providers are working with public health agencies, working with libraries. So if there's a way to keep those, we want to keep those folks in the mix as well.
And in that mix, Laura, I just add, I think it's really important to consider ECFE, early childhood family education in the public schools. I was with the Department of Education for 15 years in my past, and there was considerable involvement of family, friends, and neighbors during those periods with in ECFE programs, and they can be a training source. They can be, I look at your developing support services where you were moving Amy or Tracy, which one of you was saying that, as far as providing resources. There was a study done quite a few years ago. I think Amy Sussman-Stillman was involved with it, and I was on the advisory, where you look at the family, friend, and neighbors are functioning in a parenting role. So being a part of parenting classes where they can come and bring the children they care for, and they can either be integrated in ECFE classes or have separate ECFE classes. So that's something to think about. And I know we have an ECFE coordinator here who has, Sarah, if you're out there, has had experience working directly with family, friend, and neighbor folks just during the pandemic.
Yeah, hi,
So-
Betty. Thank you.
Thanks, Betty. Yeah, you were sneaking ahead in our questions a little bit. Thank you for calling that out. Yes.
Hi, this is Cooley of Pringle National Parent Union. I just wanted to echo what you just said. A lot of family, friends, and neighbors are providing care, especially during COVID. They're actually, because of distance learning, actually providing the school space. So making sure that families have, or these caregivers have access to educational materials, whether that's going to the the early childhood centers, or and partnering with MP or the school districts to show these providers how to teach, basic phonics, or, just reading to the kids, providing culturally responsive books. That would be helpful. And then also about the funding things. What I've noticed when it comes to grassroots orgs, or, people that are actually doing the work, regardless of how the RFP goes out, it's usually rooted in white supremacy, white framework, white everything. So even in the way the questions are asked, be conscious of that, because that might deter certain people of not understanding what it is that the department's looking for, or what it is that the RFP is looking for. I find that's a lot of barrier, which is why certain organizations always get what they need, because they could hire somebody that could get the fluff language. And, regular people don't have access to that and can be turned off by RFP languages.
Yeah, thank you for that.
I'd like to.
Laura, is your hand
Yeah.
up? Yeah.
I will now put my hand down. I wanted to just comment on a couple of things that already been said. The previous speaker, I think, spoke to the RFP challenges that might exist. And I also heard the term flexibility come from Laura. And I can tell from your write-up here that you're concerned about the cultural diversity of child care providers in the state. But I think that as you're thinking about this process, it might be really nice to kind of look at our population and to make sure that the representation of the folks who you ultimately end up funding really do represent the state population in some way. And those things don't tend to occur unless we're intentional about them. So I just want to encourage you to make sure that there's as much diversity, cultural diversity in particular, as possible among the folks who you provide grants to.
Absolutely. Thanks, Nora. I just want to look back. Did I accidentally cut you off earlier? Did you have a comment?
Oh, I was just going to thank Betty and just mention that family, friend, and neighbor care providers and parents whose family or whose children were in family, friend, and neighbor care were highly represented in our in-person classes and Sauk Rapids Rice this year, just recognizing that their kiddos were missing out on some of the opportunities that kids in center-based care or preschool settings might have been receiving. So, and we have done some formal cooperations with Milestones and done some formal classes for family, friend, and neighbor care, as I know other districts have in the past. So just wanted to call that out.
Great, thank you. Before we move on to the next question, any last thoughts on what we might be missing? And again, the conversation is not over, so you can feel free to throw them in the chat or share now or share with the next question. Anything else?
This is Laura again. I just want to also call, I added it to the chat, but one of the things that we saw during the public health emergency for FFM providers, whether they were legally non-licensed or not, is they really didn't have access to food or cleaning supplies. And yet that's where we know the majority of infants and toddlers are in this state. So I appreciate that you're all looking at allowing FFM providers who are legally non-licensed, but I think that's like 100 people in the state. I mean, it's a really small number of providers, right? But that they would potentially have access to some of those public health supports, because those costs really made it difficult for families to help care for children.
Yeah, thanks, Laura. I was just responding, but I guess I can share. Yes, less than 200 in the state, and the numbers are going down. So
I wanted to add just one thing to a comment earlier when someone was talking about, making the RFP easily understood by people who are not in the kind of white system. But I also want to make sure that people don't forget about the contracting. So if they get to the point where they actually are awarded money, sometimes the contracting with DHS or whatever organization you're is funneling the money, again, might be really, really difficult for especially an informal group. They may not have a fiscal agent. They, again, may not have $1 million of insurance and all the other things that are often required to be able to accept that money. So I think that's another thing that really has to be thought out very, very carefully when this process is put together.
great.
And I wonder if, can I ask a clarifying question? Has there been an initial, this is something that Laura alluded to, but has there been, for this money, has there been any kind of an initial needs assessment, actually not from agencies that serve providers, FFN providers, but from, getting the actual voice of the FFN provider themselves as the basis for, what this might be spent on? I'm just sort of reaffirming Laura's point and asking what actual data is available about that, or is that one of the things that has to happen during the grant?
That's a great question, Mary. I'll respond to that just in a moment, but I wanted to just go back. I think, Joan, was it you that asked about or had just made the comment around the equity piece? I just wanted to share that one of the priorities that my division is working on right now is actually exactly around that. We are looking to hire, we've committed funding to hire an equity and contracts coordinator who will help us think through how we can be more equitable in our contracting system. And so that is one of the priorities that we're working on now. So we're hoping to hire that person, crossing our fingers, in the next few months here. So I just wanted to share that update there. And then, Mary, to your question, we are anticipating on, this isn't going to be our only engagement around FFN work. We are anticipating on holding another session with some other stakeholder groups too. And we're really hoping that those stakeholder and partners could help bring in FFN providers to provide input too. So yes.
I would think they might be the majority of at least one stakeholder group. Their voices should be the loudest.
Yeah.
I also think that one piece of data that should be used in deciding who would get this money would be looking at the data on which groups, communities have children that are the least prepared for kindergarten. As we think about, that is really one of the big goals, right, is to make sure kids are prepared for kindergarten and can succeed in school. So looking at perhaps which groups, whether it be Latinos or African Americans or other smaller parts of those groups, who has kids that aren't prepared, and how can we make sure that the majority of this money goes to the children who are most in need versus just like proportioning it by who's in this state, which categories of people that are in the state.
Absolutely. Absolutely. We can keep coming with the questions too. I'm seeing in the chat, people are having questions, so please feel free.
I have a question. This is Nancy Jost. Do we know how many family, friend, and neighbor providers there are? do we know that, we say like half of infants and toddlers, sometimes I hear a third, but do we actually know in Minnesota? What is the data? I think sometimes, just what we think might be true and it might not be true. And I think we should look into, there hasn't been a child care study in Minnesota for quite a few years. And I think it would just be helpful to know what the groups that we're talking about and wanting to have public policy around. What are those groups actually? And so I was just wondering if there is any plan to find out what we're talking about when we're talking about FFN, or even licensed family child care providers, and what parents are wanting. I know there was a national group that interviewed parents, and they were saying that more and more parents are looking at FFN, but Minnesota wasn't part of that study. So I want to know the information.
Yeah, absolutely. As we said earlier, the LNL, legal non-licensed, we do track those numbers, and they are a small group, less than 200 providers in the state. As far as FFN providers, that number is a little more ambiguous, right? Because they're not necessarily attached to the state or any, data tracking methods per se. When we do our surveys that the state do every few years, those surveys don't go to those providers per se. So I think that's one piece that we're hoping to grow in with data with FFM providers through this funding, is we think about a network and we think about how do we engage everyone. And part of that is just simply how many providers are there, and then the issues and the nuances of, do FFN providers see themselves that way? Do they want to be accounted for in any way? We want to create room and space for that too. So yeah, great questions, Nancy. That's definitely, I think, some of the ultimate goals that we're trying to aim towards, as we move towards this funding and use this funding. So yeah. Any other, just looking in the chat, is there anyone else?
Andrea,
Andrea, yes.
Hi. I was just writing my comment in the chat, but then it's too long, so I'm just gonna say it.
Perfect.
So I'd like to see some resources allocated to reassessing current processes and or creating new platforms, because yes, in theory, some FFN could access the trainings in childcare aware or develop. However, thinking about the needs and profile of this specific population, and I'm talking in the Latino community, I think we need to invest in creating new ways of ensuring equitable access. A lot of FFN in the Latino community, one, they don't have their own electronic device. Second, they really struggle with the technology literacy, and our understanding is that you have to create a profile in Develop in order to have access to those trainings. So just the resources and the trainings and their knowledge are there, but somehow most of them didn't even know that those trainings were available to them, right? So just thinking about how, and I've said this in other spaces, how to create safe spaces in order for them to feel welcome, that are culturally appropriate, so we can make sure that they know, one, that the resources are there, and if that format doesn't work for some of the FFN providers, what other kind of platform can we build?
Yeah.
So that was my long comment in the chat.
Absolutely, especially when we think about, if a provider wants to become an LNL and they need to go through those trainings, it'd be good to make sure that we look at that access. In the sake of moving along with our questions and hoping to jog more voices from the group, we're going to move on to the next question. So the next one is, which of these proposed uses, so again, thinking about those three buckets and how we broke out some examples in each, which of those proposed uses most aligns thank you, with your organization's current needs and goals? So when you think about your own organization and the opportunity to apply for this funding, what makes you most excited about it? What are you already doing that you're like, if I had this funding, I could expand it? What really aligns with what you're already doing?
For me, this is Kulia Pringle again. I have had to, I work in education, mostly helping families navigate the education system. And when COVID hit, that system had shut down. And so it was navigating other systems to try to survive. One of the things that I did was create and I, did it through the grace of God and people just donating, created a homework help platform for students in person and online, just trying to take some of the burden off of parents as far as like some, kids coming home or not even coming home if they're at distance learning, not knowing if the kid has homework or not being able to keep up for whatever reason. Maybe if they can keep up. A lot of our Somali moms and Latine moms who didn't speak English and who wasn't educated on the platforms and what to do when it comes to navigating distance learning, making sure that I was teaching parents that, but then also, like I said, decreasing that barrier of having someone there on a regular basis for free, where they didn't have to seek out because I literally sought them out to offer them my resources. So because of distance learning, a lot of BIPOC communities had to figure out creative caregiving ways, depending on, if somebody had to work or not. Somebody also brought it up before again too, like just making sure that whatever the process is, you've got families that don't know. So you're gonna, whatever the process is, has to be a way to get them into the know, and it has to be in a way that they understand in their own cultural terms what that process is.
Yeah, definitely. I'm hearing you say a lot in that, and it just makes me think of that communications and marketing and outreach piece that organizations can do to support families. Absolutely. And again, just a reminder, you can feel free to throw ideas in the chat as well. We're monitoring that too. Any other thoughts just around, how these uses align with your, or what else your organizations are currently, what their needs are, or what their goals are, what they would like to be doing? If you were like, hey, I have all of this funding now, we can do this dream project, what would that look like?
I really do like the comment that was made about innovation, because sometimes organizations are out discovering things that the rest of us don't know anything about just because they have a need for it, to be creative in that way. And that didn't appear to be a category. Maybe it could fit under any of the categories that you had, but maybe if you call that out, that might be helpful to lots of organizations that might otherwise not.
For sure, innovation.
I would just say that in answering to this question, I was involved with the establishment of the LARED network here in Bloomington and Richfield. And so that was certainly one aligns with what we have done in the past. I know that there are other communities that are interested in this. And one of the problems with the funding we have in public health, there are restrictions on what we can use that funding for. So it had to be on, nutrition and physical activity. That's all I could use it for as far as training. And so having another pot of money that would be more broadly applicable to anything that a child care network needed, an FFM network needed, would be really, really helpful. And so really it's the establishing a system or a network locally, and then also being able to help them with the costs of getting trainers in the specific language or culture that makes it easier for them to learn and also know that they're in a safe place as well.
Definitely. Strengthening networks. Yep.
we've had a few comments in the chat as well about ECFE, and I'll just share that, with additional funding, ECFE is really designed to respond to community needs. During the pandemic, it's been wonderful to see how ECFE educators can do home visiting, we've been doing that for a long time, but, virtual home visiting and call-in times so that, it's just an open time. Lots of families who are feeling like they're facing a variety of crises can call in, and this can be any kind of care provider, FFN, parent. Really, there's so much flexibility within ECFE to adapt and innovate programming to serve the needs that are present and to respond to those needs. And so that's why we're really interested in sort of expanding and growing and responding to this conversation that we're having. Also, we're really interested in connecting with FFN providers so that if they would like to come to school, there's opportunities for that. If they would like to connect with parent educators to have them come out to their home, that's a possibility. And even, ECFE served about 50,000 parents and children just in the last year, and a large percentage of them are connected with FFN providers. So even just having ECFE as sort of a connector to, engage with, Mary Kay was talking about connecting to FFN providers to learn what their needs are. So that's an option as well. And ECFE would be very happy to be involved in all of that.
I just received, this is Ada Alden, I just received a question from a retired pediatrician with whom I've been working. And the question was, do FNNs or family, friends, and neighbors need to be part of an organization in order to receive dollars or other support? How do they receive the dollars?
No, they don't necessarily do, but there is kind of that fine line between if they're not associated with any kind of network or organization, how do we funnel that funding to them? Again, I don't know that there's like a legal yes or no. So yes, I think it depends what dollars and at what point.
Yeah. This is Ronell Robinson. I wanted to piggyback off of what Heather was saying. I'm with Way to Grow, home visiting program serving Minneapolis and surrounding areas. And, just with the connection with families of various cultures and language backgrounds, working already with some home daycare providers, our staff is indirectly, providing some of that educational information. Just based on what we do. We work with a couple of licensed home daycare providers as well. But, referring families even to looking at the grant opportunities is a big thing. So, having staff that speak a variety of languages to be able to just relay the information, and that, this would support the development, the education, the health of all children, to provide this information and to provide, them with more materials and education supports to develop that. I mean, we know a couple of people, they're just, doing it co-op style on taking care of the kids. And it's, they're struggling with it because some of them are young, very young moms. And we're just getting connected with them, but their schedules are so busy that it's hard to even provide minimal information because they've got like 2 or 3 little kids running around of their, their friends' kids that they're providing for. So I think it's really just, yeah, you can build those networks, you can build that system, but it's kind of the one-on-one, or like you said, early childhood center or home visiting that is going to connect and get this information out to people, but then also to implement it to make sure, do they need support with filling out the RFP application, who is going to be in place to provide that support to get that done. And then if there's reporting out pieces, things that are going to be required of it, just how that process might look.
Absolutely. I think on that comment, and then also Heather's before, there has been a few good references to ECFE. And so I do want to just jump to one of our last questions to make sure we capture any more network conversations. Jeff, if you wouldn't mind, we do have a question just around that we know that there are a lot of points of interaction for FFM providers, including ECFE, home visiting, libraries, parks and rec, schools even. I know that was mentioned earlier. Just generally, what input do you have on how we might better coordinate across agencies to support FFMs within these existing programs and services? In particular, is there any ideas you have about how this funding could support that connection or that coordination?
What kind of handle do we have on childcare providers? I mean, do we have a really good sense of what the ecosystem looks like and who all of the small players are and the large players? Or, I mean, is there data that exists on that?
Yes, if they're registered with the state, yep.
But if they're not registered at the state, then that creates a challenge. Yeah.
Yes, then it's more towards with our network partners, community partners. Yep.
Amy, this is Marisol. This question is a good one, and it makes me think about, I was so excited and happy when I was listening to some of the people in the call saying, we could use ECFE training that is available to support FFM providers, and we could use funding that is available to do home visiting and all that. But if you're asking me that if this money could help, I'm thinking this is $3 million. It's not a lot of money. Can those other entities, groups, initiatives, and programs that are getting a lot of, higher, like a lot more funding to do their work, which I know it's complex and it's really important, use part of that money to still open up those opportunities for FFM providers? So this pot of money, $3 million, is not a lot. It's great. It's more than $1 million. We're really happy about that increase. But the truth is that it's not a lot of money for everything that we want to do, right? And everything that is needed. So I'm hoping that the possibilities there for those that could support FFNs that have the funding from the other millions that are available for childcare to do that without touching this pot of money that could go to directly support networks statewide.
Absolutely. And that's why we asked this question, because that's a great point, because that makes us think internally, making sure we're involved in those conversations to leverage where that other funding is going. So that's a great point. Thanks, Marisol.
So something that could be done, this is Jane Kretzman, to me, one of the opportunities could be, building on what Marisol has said, is using interagency agreements that the Department of Human Services could work more with MDE, which is where early childhood family ed and home visiting, which is also in education, which is also in human services and also in health. But ways that, as you say, Marisol, can access these other opportunities that FFN are eligible for, but we've got to really make sure that's clear. both policy wise, but also there could be money. This money could help infuse those other systems to do more work more effectively. But I don't know. That's different than what you're saying about actually building a system of FFM providers, and I'm not sure what that would look like. So anyway, I'll be quiet, but just a thought.
Yeah, thanks, Jane. That's really great. And I think that's part of the context around this conversation is that in addition to this RFP to distribute the funds directly is like what other mechanisms is the state taking or using and making use of to build that network that involves in addition to distribution of the funds. And what sort of infrastructure are we building around that makes use of those connections to programs that intersect with families and FFMs like ECFE, with like home visiting, like what are the both and approaches instead of let's try and like nickel and dime this 3 million in as many ways as possible. It's like, how can we be using a distribution of funds strategically within all of these other mechanisms? And so it's great to hear you call that out. Yeah.
Great. Thank you. Sorry, just responding to a comment in the chat as well. Any other thoughts about coordinating systems? Otherwise, we can move to our last closing question.
I have one thought, extra thought. Again, it's, where do people go, if you want to reach people? And the medical system, the pediatric system and well child visits is really an important access to families and FFM providers also if they're doing the caretaking. And I'm just wondering if there needs to be, one of your things was about marketing, and I think in the first bucket. And I'm just wondering if something like, does every well child visit contain a question about where is the family getting childcare? Because that would expand the contacts then that they could be referred to different organizations that would be able to help. But I wonder if that question gets asked in well child visits.
I'm not sure, but that's an interesting idea. The idea of, yeah, really intentionally coordinating those interactions that exist. Absolutely. Yeah, thanks. Okay, I think we're going to move on to our last question in the effort of time management. And it's very broad. Just if there's any other input that you want to provide at this time as the state begins to develop the RFP process. We've heard such a wide range of input today. Everything from making sure that the way that the grant is worded is equitable and representative, and the special consideration on making sure that providers have a voice and that providers receive actual funding as well and have a voice in all of this. So a whole range of topics. Is there any other input in the last few minutes?
I'm just going to piggyback on Mary Kay since there was a pause there. Back in the day, when I was at the department, the Minnesota Medical Association had little RX pads in all the clinics and pediatric places, clinics and so forth. And they were just a little thing that a parent could take sitting there while they're waiting that said, if you, something about support with parenting, contact Way to Grow, ECFE, or MELD, which Mary Kay used to be head of. And so again, I'm reinforcing that idea through the health system. And this wasn't even in the doctors necessarily, maybe they passed it out, but it was also just something there that could be picked up as you were waiting or coming in or out in hospitals too.
That also makes me think about the Reach Out and Read organization, because they are connected with the healthcare system and providing books. And I wonder if there's a way to coordinate so that information is included along with a book. You know, the book is really a children's book, and maybe there could be sort of information for the provider along with that.
Great ideas. Thank you. Yeah.
I think in answer to this question, you should consider giving, extra points or priority to people who actually have a provable connection to FFNs, not just an organization that does other things. It's important, I think, because FFNs, because of the fact that they're just in community and they're not organized and they're not necessarily known, that whoever gets this money ought to have a leg up on already making connections with communities that use a lot of FFNs or have actual direct connection to FFNs, so that we make sure that the money gets directly to the right people and provide the services they need, versus just a big organization that is used to getting a lot of DHS money.
I want to echo that. It seems to me that you haven't, some of the money, some small portion of the money needs to go to mapping the ecosystem. It just doesn't seem like you all really know, other than those big institutions, who's actually doing the work. So to do that community assessment or whatever it would be called just seems like an important piece, because it sounds like you're already missing a lot of people who are doing the work, and giving big money out to just what she just said. The people who actually need to get the money aren't likely to get it. So I don't know how to say that better.
That was really well said. Thank you.
Great. Well, we are at time, I believe, so I can turn it over to Tracy to close.
Sorry, I got so wrapped up in the conversation. I could keep going on all day, but I appreciate all of your time so much and all of the incredibly engaged information. Thank you so much for your partnership in this area. And so as we close, on the back end, we've been frantically taking notes and tracking and listening to the conversation. And what I'll echo, something that I think Cindy said earlier in this conversation, is this conversation today is a beginning. It's not an ending point. And we hope to take back all the input, do some synthesis and analysis, lift up some things, and have additional conversations with as many of you who are able to continue the partnership with us as we continue to craft the package of what this looks like going forward. And so I will close with that we, again, appreciate your input, your partnership, and look forward to next steps. Cindy, I see you put a note in the chat thanking everyone. If there's anything else you want to add, Cindy, or otherwise I'll turn it back over to Laura to close us out formally with the Zoom.
Well, thank you everybody for joining us. If you have additional information you'd like to share, like I noticed, Jane, you offered to share some information about the Strengthening Families, you can please do so directly to Cindy and Tracy and Amy, who are on this call. If you don't have access to their emails, they were in the announcement that went out. So you can reach out to them directly, or feel free to reach back to me, and I'm happy to make those connections. But thank you, everybody. We really appreciate the great input here today. And Cindy, Tracy, Amy, and Jeff, thank you very much for taking the time to hear from multiple stakeholders on this important opportunity. All right, be well.
Thank you.
Thank you.